Should you take the Covid-19 vaccine?
Hello and welcome to the Mark and Pete Show. Well, as we've seen, 90-year-old Margaret Keenan became the first person in the world outside of clinical trials to receive the Covid-19 vaccine.
Yep.
Wow, fantastic. And she was delighted, in fact, thought that this was the best day of her entire life. Well, many people are extremely excited over the fact that clinical trials have been pushed through, accelerated, and we now have a vaccine, and it's been rolled out across the world. But is this a good thing? Some people are somewhat skeptical about the idea of the fab jab. From something that's horrific and extremely prolific, as well as morbific, to then being scientific, with a vaccine that's specific. But should we be feeling terrific? Clergyman Pete, I ask you, will you be in line to receive the vaccine?
Well, I don't think I'll be in line for it because I'm just too young and healthy and attractive. I think all these things were
It all adds up.
It all adds up. Yeah. Yes, I don't think I'm in line because I think they're focusing on specific people groups in the rollout to start with, at least. So I don't think I'm in line for it. I mean, the question would be if offered, would I take it? And just to set the scene for our discussion here, I would say no. I would. I mean, if the government were to introduce draconian measures to force me to take it, I would, of course, immediately give in and say, thank you, Boris, thank you, Matt Hancock, for giving me this wonderful thing. But just assessing the risk of just taking the vaccine against, I wouldn't take it, at least not at this stage, just as it's been released.
Well, is that as a result of perhaps accelerated trials? Now, normally, as we know, that clinical trials take many, many years, and not simply a matter of weeks and months.
You're right.
And many people, like Clergyman Pete, are slightly concerned that perhaps we're not entirely sure of the symptoms. Now, interestingly enough, for those who've been watching the news, you'll notice that this isn't a one jab and go. This is actually a two-stage effect. So what typically has to happen is that many vaccines which are being issued across the United Kingdom at this moment in time as we speak actually comes in two stages. First of all, you have one particular inoculation, and then after 21 days you then have another one. They have to be apart. So of course there's the coordination on that level. We don't know, of course, ultimately what that's going to do to those who are vulnerable. Now, when we talk about that, there's actually almost like a league table of the first phase of those who are offered the vaccination. The first is really targeted at residents in care homes for older adults and their carers. So the idea being is that you're treating the most vulnerable. Then on the league table would be those who are 80 years of age and over. Effectively also those frontline health and social care workers would be in line too. And then after that, you then have a league system depending on your age and, of course, your state of health. So, for example, third on the list, on the official list, folks, are those who are 75 years of age and over. And then it goes to 70, 65, 60, and so on. Now, Clergyman Pete, I must ask you this question, that whilst it's clear that we need to help the vulnerable, what about those people who are probably looking at that league table and thinking, now where do I sit? And then wherever you may be, whether you're, say, 40, 50, 60 or over, you might be thinking, well, I'm perfectly healthy, I'm active, I'm fit, I can cope with most diseases that typically tend to sort of be thrown your way in a seasonal fashion, like flus, etc. Why would anybody really feel comfortable taking an inoculation without really knowing the consequences?
Yes. I mean, I think that is the issue. It's a question, in this case, of weighing up the risks. Now, earlier, gentle listener Mark was talking about the symptoms, referring to the symptoms of taking the vaccine, the side effects of it. And we don't know what they might be.
Yes.
because although they've done trials and they say, well, this is safe, and there were some deaths during the trial, but it seems from the
But
reporting
that seems to have been glossed over a little bit.
yeah, but the reason for it is that these deaths weren't associated with taking the vaccine. There were deaths that could be attributed to other things. So, in other words, they may well have died even without taking the vaccine. So, other trials of this is of a different vaccine have resulted in Bell's palsy, which is rather serious, causing a bit of paralysis, and so that's serious. But that's not this vaccine that's been rolled out across Britain. 800,000 doses of it over the next few weeks. Now, the sheer number of it and the fact that it hasn't been tested, hasn't been trialled for very long, are what's give me pause, and what should give you pause in weighing up whether the risks of taking it are less than the risks of catching the disease. That's what I mean. Now, because the disease, although it's a very unpleasant disease, it can be if you have a serious form of it. It can have what's been called long COVID, meaning you have a post-viral syndrome, which is common with any sort of virus. Although that can happen in a few cases, people can actually dying. It's about 0.1% we're looking at across all age ranges across the world. So the death rate, if you've caught the disease, is quite low for most people. Now, the reason why we say, well, let's give them the vaccine, which is a preventative measure against if you catch the virus, it's producing the disease. So it doesn't stop you getting the virus. It's not like a barrier at the surface of you. It's once the virus gets into you, it enables your body to destroy it by having cells in there which remember it's what kills it and produce the antibodies ready. So it's preparing your body for it. Now, for most people with a healthy immune system, they may not even need antibodies in order to fight it off. They can fight it off with their T cells, which will kill the disease effectively. If you start to develop the disease, you produce antibodies. So you could do that if you've got a healthy immune system. As you get older, your immune system gets worse. So a vaccine of this sort can help. Yes. So you're balancing it up, but weighing up the relative risks: risk of catching the disease, risk of having taken this vaccine, which hasn't been trialled out in the community. Well, and the problem with it is, just finally, is we're being sold a lie, really, in that the lie is about how deadly the disease is. And until there's actual honest reporting of how low the mortality rate is, you're not really able to make an informed decision. So I want more clarity on that, I think, from the government, from the health department, would be very useful for people who I think need to be able to make up their own mind about whether to take this.
Well, exactly. And I think that, this is a serious matter. And many people also think about it from the logistical perspective. So the Pfizer BioNTech was the first vaccine to be published, or at least to show the positive results from their testing. Now, the challenge that we have here is the actual distribution, because it has to be stored at minus 70 degrees C, and it has to be transported in special boxes of up to 5,000 doses and packed in dry ice. Now, when you think about that, there are many challenges, because typically once it's delivered and it's received to either a hospital or a GP surgery or any other medical center, it has to be and can only be kept for 5 days in a fridge. Now, once it's out of that fridge, it needs to be used within 6 hours. That's a very short period of time.
Sure, yeah.
And what I'm thinking of here is that, of course, with this whole vaccination program, we'll call it a program, that requires a lot of coordination, cooperation, and efficiency. We know that has to be very, very precise. And so there is that side of it as well, as to how realistic that can be implemented. And at the same time, is that how can we really be sure as a patient that the vaccination has been truly kept in those conditions, without, so for example, once it comes out of the fridge, that it hasn't been lurking around for more than 6 hours, and you then receive it. The point here is, as a patient, normally with things like a clinical trial, you would have worked all this out. I don't believe that that's been part of the process. Well, we know it isn't, because we haven't had the time to determine what's going to happen after the second dosage and the implications. There's also the other side as well, which is the cost. And I think that we don't want to necessarily put cost over people's health and lives. We want to make sure that we prioritize and keep people alive. But my concern here is that when you look at the league table, there are people who are listed in the league table that there will always be exceptions. I just wonder that when we think about people who are 50 years and older, there are a lot of very fit people who could certainly survive without actually having the need for the vaccine.
I agree. Yes, I agree.
And so the question then is, who makes the decision? So should it be the GP that actually makes the decision that you should have it, or should it be that the patient demands it? Yeah. And so I just wanted to sort of cover that side of it, because you may feel as a citizen thinking, look, I'm 60 years old, I think I'm okay, but I'm not sure, but I best have it. So therefore you demand it. Well, how do you make that decision? Who makes that call?
Yes, that's right. I mean, I think this is how I see it, the balance of power. I think doctors and the medical profession and the Department of Health perfectly at liberty to give advice and to say, yes, no, we think you should have it, but it should be up to you whether you have it. Now, the issue with this is that if you have a disease which is a new disease and it's got a high mortality rate, you want to get vaccination across the whole country so that basically the disease can't really be passed around anymore because people aren't developing the disease. And we know that this sort of virus is not passed on, virtually never passed on, if you don't have any symptoms. That's another side of it's really a lie, I guess, that has been passed on, that somehow you'll spread it if you don't have symptoms. That really isn't happening. But if you have a disease like that, yes, you would want to have a vaccine across the country. It's not that sort of disease. The mortality rate's very low, and people already had a partial immunity to it because they'd caught colds and stuff, which are very similar, and some people had COVID SARS-1, the first of these COVID diseases to come out of the East. Now, this is a different sort of disease. It's a disease where you say you don't need blanket vaccination. You just don't need it. What we're talking about is protecting the vulnerable. So you should be able to make that assessment. And if you really don't want to take it, it's your life. You take the risks. That's what I'm saying. We're in that sort of position, not in that if people don't take it, it puts the rest of the country at risk. That just isn't the case. I mean, there's one other thing I want to bring in here, Mark, that there is a further risk brought about by the sheer numbers of people who are going to be vaccinated, in that we've got people like pharmacists and midwives and physiotherapists being expected to be quickly trained up to deliver the vaccine. I mean, they already do some vaccination. That's fair enough, but I think I'd prefer a real skilled professional to do it.
Yes, a dedicated doctor or nurse.
Yeah. I mean, they already do flu vaccines. That's why they're being suggested. But I think the skill in administering it, and as you say, this book came to my mind because you were talking about how difficult this vaccine is to store. I mean, there are certain procedures that need to be in place.
Precisely.
So so it's just to go back to the point I was making about we were talking about who makes the decision. I personally, I'm happy for the health department. I think it's a good idea for them to be proactive on what they see as being the right decision for you. But then you make the decision, and they should put all the information out there so that you can make an informed decision. Yeah, I mean that's informed consent is the basis, or should be the basis of of how we run our health system in this country. Supposedly, it is.
Well, I'm going to add something here which is perhaps clouding the issue, but I'm going to have to bring it up because we've talked about the vaccine, but we're also going to talk about the government's initiative on the tier system.
Oh dear. Yes.
And many citizens are slightly confused over this, but
Yes. I'm tearing up about it myself.
I want to come back to the point about what citizens want and where they can make perhaps a call on this. And so we have seen that there are effectively three tiers. There's tier 1 and tier 2 and tier 3. Tier 3 meaning that the initiative is that you would see in that community, whether it's a city, whether it's a town, a village, or wherever, is deemed to have the highest concentration of people who have contracted COVID-19. And that's measured against testing and a number of other things. So when we're thinking about if you're a citizen actually in a tier 3 community, some people, and again I'm trying to look at it from different angles, might be saying, so therefore I would be better placed to have the vaccine. So here's just one little thought, just hold my thought here, because I think it's strange in the idea that the tier system almost essentially makes you immune by the lockdown, in the sense that, well, you could catch it from any source. So it's almost like the 3 tiers for the fight against COVID-19. So here you go, Clergyman Pete. Do you know where you should be in tier 1, tier 2, tier 3? Social distancing is the key, so keep away from me. Do you know what is really going on in tier 3, tier 2, tier 1? Stay at home until there's none, and the fight is truly won. So that's how some people think.
Yes.
What's your view on the tier system?
I think the tier system is very confusing. Some tiers you can have a beer, sometimes you can't,
Exactly.
and you have to have it with food. It all gets very complicated. I understand the rationale behind tier systems if they had any effect, but as we know all the data is in. There's been many, over 20, I think, scientific papers looking at this, peer-reviewed scientific papers in major journals, all showing that lockdowns had no effect. Now, a tier system is an area-based lockdown, so we shouldn't be doing this. They do not do anything. Introducing vaccines, good idea for those done in a controlled manner with sufficient testing, and recognizing that could take years. That means we're not saying you should be doing it now, but for the vulnerable, that's good, but not mass vaccination over all age groups. And the tiers themselves, they would have an effect on whether you think you're at greater risk if you believe that the tier systems were actually doing anything, and then they cannot be doing it. They cannot be having an effect. I think this the normal question that someone asks is, well, why are people doing it around the world? Why is our government making this decision? And I think it's an effect of two things. You could just simply look at it. You could say one is hubris. We have to believe that we can make a difference, and can't believe that with some things in the natural world, there's just nothing you can do. So just the natural process will play itself out. And the other thing is fear of the electorate, who are informed by and panicked by social media, etc. And so the two things together have meant that decisions have coalesced around copying what China did. And I think in their original lockdown system, whereas before COVID-19 came, lockdowns were not advised, not even individual isolation when you had the disease was advised for this sort of pandemic. And so let's tell everyone that that the tier system, and in fact lockdowns in general, just haven't worked. Let's just stop. Let's just recognise that really this pandemic is over as a pandemic, but people would still catch the disease. It's a horrible disease, so let's get the vaccine properly tested and out in the community. That sort of measured approach is the way forward. The tiers Absolute madness.
Tears of joy or tears of sadness.
The tears of a clown.
Well, quite. I mean, look, so I know that, just sort of conclude on this, is that some people are confused, and it's natural that they would be. They're not entirely sure what they should be doing and what is the best practice. I think that interesting comments that were made by the World Health Organization's Dr. David Nabarro, who said that the Pfizer vaccine would not replace other measures. So he said, for a number of months, even a year, we'll have to just keep doing physical distancing, mask wearing, hygiene, and isolating ourselves when we're sick. Now, that's true. I think that there is an element of that. And I think really the indication here is that essentially, as he continued, and when he had an interview in a media recently, was that the vaccine will only start to dent the size of the pandemic somewhat later in the year. Well, of course, these things are obviously being measured all the time. But I think it is a combination of different things. But it's also being honest with oneself that, good hygiene is important. Wash your hands. Make sure that you do have certain amount of social distancing. The mask wearing is a rat hole. I'm not going to go there because I know that your view is that perhaps we shouldn't be wearing masks. But at the end of the day, what I would say is that if you're healthy normally, and if you are not known to have underlying health conditions, then maybe we should start to think a little bit more differently about the lockdown or semi-lockdown systems and the tier systems, and think about it in a different way, because COVID-19 itself doesn't actually appreciate tier systems. And the irony, as we talked about in previous podcasts, that some communities are literally only a few hundred meters away from one another. So it makes very little difference in terms of where you're traveling and where you're going. But what does matter is how you behave and what you do and how you look after yourself. I would say one other thing, which I think is important, particularly when it comes to the vaccine itself, and that is I think you need to have a consultation with your GP, your general practitioner, because ultimately that's where I think you can make an educated decision as to whether it's right for you to take the vaccine. And I think that's probably one piece of advice that I would give. But listeners, what do you think? Do you believe that you're just going to wait for the call? And are you on the list? Are you perhaps one of those individuals that you think should take the vaccine irrespective of the state of health? Or maybe you feel like us that actually you think maybe you need to see more clinical trials and just have a little bit more data on the efficacy of the actual vaccine itself. Why not log on to markandpete.com and let us know your thoughts? Well, join us again next time for more topical topics with Clergyman Pete and Businessman Mark.